Good evening, everyone. We're just going to wait a few minutes for Dr. Rajeev Fernando, infectious disease specialist, to join us. I'm going to be having Dr. Fernando join us right now. Just stay tuned. We're waiting for infectious disease specialist Dr. Fernando to join us. Tonight we're going to be discussing the state of the healthcare workers and what it's like to do a look back at the last 4 months. We're going to be talking about some new testing or some new studies regarding antibody testing, and we're also going to talk about the spike in testing that we're seeing across the country, and ask Dr. Fernando what he thinks as far as will this spike across the country come back to New York and flatten the curve here. Jim, thank you. I might get a earpiece. Let's see if Dr. Fernando is available. All right. I don't know if people can hear. Please stay tuned. Dr. Fernando is going to be joining us shortly. Okay. Jim, thank you very much. We are waiting for Dr. Fernando here. Feel free to ask questions in the meantime. Thank you. We're doing very well. We're just waiting for Dr. Fernando. Please just stay tuned. Jim, I'm just going to repeat. Here he is. Dr. Fernando is waiting here with Dr. Fernando. Okay, everyone. Dr. Fernando is joining us. There he is, showing us.
Good evening.
Good evening, Dr. Fernando. So,
Good evening, Mr. Mayor.
Thank you. Just a quick introduction here. Dr. Fernando, for those who don't know, is a Southampton-based infectious disease specialist. He has done work with Doctors Without Borders prior to the coronavirus outbreak here. He was in Wuhan, China. He recently was asked to actually help out in Brazil, given the peak of cases they're seeing there. And Dr. Fernando, who works at Southampton Hospital, is also been featured in the New York Times, Bloomberg, as well as other publications. And so he has become quite the authority on COVID-19. So with that being said, thank you everyone for joining us. Dr. Fernando, how are you? And maybe you can give us a quick update on how it's going at the local hospitals. And now that you've had some time to digest the situation, what was it like for, healthcare workers, and how are you guys feeling right now?
Thank you for your introduction, Mr. Mayor. It's wonderful to be here and talk to the people of the community how to stay safe, because I feel this is not over yet. Let's go to your first question, where you want to know how healthcare workers are doing. And I feel all my colleagues did a wonderful job: nurses, physicians, CNAs, respiratory therapists, to curb this spread and to bring New York to where it is right now. The last I checked, there was about 10 deaths in New York itself yesterday. So we've come a long way from what we had in March. And it's really a great effort of teamwork, what everyone did together, healthcare, government, and the people of the community itself. They did a wonderful job to get to where we are right now. People are still fatigued. The healthcare industry, the people are still kind of, getting out of what we really experienced the first time. And I wouldn't even say the first time. I really think it's ongoing at this point. But things have been great in New York because of this triangle of cooperation between all of us. But if this were to happen again quickly, I think we'll be in a situation where the mind is willing, but the flesh and mental status may not be willing. So really, it's all up to the community to help us out over here.
Thank you, Dr. Fernando. So personally, after being on conference call after conference call and being on the front lines, with you as a healthcare, professional, when I see headlines that there's a dramatic increase in new positive tests and new hospitalizations in Arizona, in Florida, in California, I'm a bit concerned. Could you talk to us? Is that a real concern? And what should we expect? Because we're doing great in New York. Our curve has been flattened. Yeah. But what's going on in other states, and will that come back to New York?
Yeah, this is very, very concerning, and I'd been doing some interviews about this, and this is very worrisome. Where you have a governor, no, not to be political or anything, but where you have a governor in Florida just moving forward and say, "We'll get through this," despite having record number of cases every day. The case toll is increasing, and I think it's very cavalier to just say we're going to push through this, and that's really not the approach. And I fear for us in New York, by yourself as well, who've done such a good job with the community, keeping things at bay, giving masks, giving sanitizers, just great efforts from you and the government to keep this safe. But remember, all it takes is a single person to come in who's infected and go to a bar, and things can just change. It's what we call a super spreader, where someone just comes in and just, ordinarily you have a smaller spread, but you have this entity, what's called a super spreader, comes in, goes to a bar, damn, it just starts spreading. And the next day you got a boatload of cases. So that's how close we are to reopening a chapter in New York. Very, very concerning. And I strongly think the governor should really move to quarantining these people coming from different states where they're just asymptomatic cases out there. And I really fear for New York. So I hope our governor does the right thing and make some tough decisions and move forward with that.
Thank you, Dr. Fernando. I want to get to antibody testing and some of the new studies that have actually shown that maybe it's not this immunity passport. But before that, I do see some questions coming in, and sure. I see Jody Martini saying, driving through any of the towns in the Hamptons, you would never think there is a pandemic happening. There are crowds all over Main Street at bars and restaurants. So, Jody, I agree. I see it happening. I've been out handing out masks and giving people, really politely asking people to do that. But Dr. Fernando, what would you tell the community in light of that? And Jody, just so you know, I actually reached out to the governor's office and I asked to actually send, if we can get some assistance from the state and from law enforcement from the state to politely remind people to wear face coverings and to socially distance. But Dr. Fernando, can you talk about that? I mean, are you concerned about that? I am. I mean, I think that we're moving into phase 3. We're happy about it, but at the same time, how can we be a little more careful?
No, I'm in complete agreement with you. And unfortunately, I think, Mr. Mayor, the only way to really do this is to mandate masks. That's really what this comes down to. In America, we love our freedom, and, it's become, not to say one thing, but it's sort of become like a political issue about wearing masks, not what party suggests this and who you're going to support. And that's unfortunate because really, remember, by wearing a mask, you have to think about the other people who you could be infecting. Elderly people who can get really sick, people with compromised immune systems who can get really sick. So it's not about you and the mask, it's about others. So I really urge people, when you put on a mask, to really think about how you can help other people, not yourself. It's really important for people to be cognizant of that, and not by saying, oh, in America, I love my freedom. Forget that. We're in a pandemic and you really have to be respectful to the other people. So for that reason alone, I think you should be wearing masks. And I try not to be angry at people. And I just say, hey, if I see someone without a mask, I say, hey, let's talk this over. Can you give me some of your reasons why you think wearing a mask is not necessary? And I've taken that approach where I take a step back rather than saying, what's wrong with this guy? Why isn't he wearing? Take a step back and, talk to these people and understand why they're not wearing a mask. And I think it's important for us to, further educate. And most people end up wearing masks after that, after they realize they could pose a deadly risk to other people.
Exactly. So talk to us about, I just want to transition here. We'll get to some of the other questions and comments, but there's been some new studies out there about antibody testing. Could you tell us what those studies are saying and talked about all the research that's coming in regarding the antibody tests that are
Sure. So just from day one, actually, I've never been confident in this antibody testing at all. Initially the FDA just approved a bunch of tests and just said, if you want to get tested, if you have the capacity to test for antibodies, here you go, use the license, just keep going. And that actually caused so many false negative tests in the market. People who were probably just saying, hey, let me get a beer today, and say, oh, well, they say we can do approval tests in the market, let's just join. So people without any experience whatsoever were just allowed to get into the American market and say, hey, we're professionals, we can start testing. And the answer was yes, let's go for it. So that's what started things off in such a bad way. And I haven't even gotten tested, because I ask myself, if I get tested, what am I looking for? I'm looking for a certain answer, and what if I don't get it? So it's just, and are these tests valid? So you have so many different situations here, and I fear for people who say that once they get the test and they have antibody levels, this false sense of immunity, or immunity passport, what we've been discussing. Once people have these tests which say I'm immune, people will just say, well, I've got a passport immunity. It's sort of like a get out of jail card in Monopoly, where you say, well, I'm immune, I can keep doing my things. And you tend to stop wearing masks. And what we're learning about this virus, it's very fascinating, as opposed to even a month ago, where myself included, I would say, well, this is a respiratory virus which really thrives in the winter time, cold weather. Not the case right now. So this virus is defying all the rules. And it's very, very worrisome. We have to watch this. And I'm even more concerned than I was about a month ago, because this is breaking all the rules. It's thriving in India, warm conditions. It's thriving in Arizona, really warm conditions. So this is not a winter virus anymore. This is here to stay. And I don't even know whether we'll start seeing a second wave, because I think it's just going to be a continuous wave at this point. So very, very difficult situations. And the couple of studies which came out, and this is the whole problem. There's some data from China which I'm obviously very thinking about interpreting their results. I'm very mindful about that. But they say studies have shown that people, after 2 or 3 months, traditionally, let me put it this way, Mr. Mayor. So traditionally, when someone gets an infection, the body recovers by producing antibodies against the infection. Antibodies are formed. Man lives happily ever after. We're done. But with this infection, or this virus, we're seeing antibody levels rise. And so someone may have a positive test after testing for 2 weeks. They say, I had the virus 2 weeks ago, bang, you're positive. But repeat testing in about 3 months shows it's negative, actually. So, I mean, it's concerning that the body's immune response is waning, where you see, the body says, all right, I've got antibodies, but a couple of months later, these antibodies are fading away, rendering you once again susceptible to infection. So these are very concerning times, and nobody at this point has come out with some really great antibody testing right now. So it's challenging times for all of us.
So let me just maybe, get this straight here. You're saying maybe no second wave, maybe we'll just have a continuation of a first wave until there's a vaccine? I mean, what are you forecasting, and what is the medical community seeing? It sounds a bit concerning.
Yeah, right now I would just not even think about the second wave, which is months away. I would just focus on this first wave that we're having. And a second wave would really come if you see a complete, all the cases have resolved. America's back to normal. New York, 10 deaths a couple of days ago. Everything is completely back to normal. And then you see another rise. But here around the country, we're still seeing so many cases. So with New York, it's a different story. But let's talk about the country as a whole. A lot of places haven't even stopped their infections. They're still rising infections. So it's going to keep staying at that pace, at that level. New York would be a different story because we've resolved. But just across the planet, I think 2 days ago, the planet recorded about 183,000 new cases, which is the highest ever so far. So this is not going away. And I'm very worried about this, especially noticing the last 3 to 4 weeks where I'm watching for summer trends to go down. It's not going away. So I'm very, very concerned. The riots probably, or people coming out and protesting, it's the right thing to do. I mean, peaceful protesting is the right thing to do. We have certain situations in this country with racism and things that peaceful protesting is okay, but there are also people coming for these events without masks, and these protests are going on every weekend. So these are really hard times, and quite frankly, I haven't been this worried. Just over the last month, I've gotten very concerned and worried.
So we have a few other questions, but I see a lot of people asking, what are your thoughts on people reusing face masks? How effective are they? We have a question here.
Yeah, thanks for all those questions. Really, the face mask. Well, let's start off with what is the number one way to prevent getting infected, and the number one way to prevent getting infected is a lockdown. Take it to the bank. It's clear cut. I mean, all the countries around the world have reduced those infections by staying at home. But man was not meant to be at home. I mean, we're gonna get out. We have to do our things. We had weeks and weeks inside, and that's what really flattened the curve in New York and with all of us in Southampton. That's the number one way to prevent infections: stay inside. The absolute very close second, number 2 point to decrease infections is a mask. There's really no way around it. I really think also social distancing, it just complements wearing the mask. I don't think social distancing alone, it complements the mask. But the mask, remember, these are viruses, and spreading these atomization of the spread is really the mask which prevents the virions from going out. So it's pretty straightforward that this is the top way to prevent.
Dr. Fernando, what about reusing the mask? Is that okay? And how many times can you reuse one?
Yeah, great question, Mr. Mayor. So I think in a perfect world, the one I'm wearing right now these are disposable masks. And, the way we have this is really at the end of the day, you're okay with disposing as long as you have. I will get to more PPE in a minute. But really, if you have a mask like this, a one-off use is fine. Otherwise, you can take it at home, keep it in a cooler area, and use it again. If you see any sort of soiling, that's a wrap. Just take it out, throw it in the trash, and you're done with that. But now we're seeing so many clothing masks, actually, which have come out with cotton clothing masks, which are regulated by the CDC. They've given their recommendations. And that's pretty reasonable as well. You can wear it, rewash it, and things of that. So it's perfectly fine to, I see a question about bandana users. I think that's reasonable as well. I'm not a big fan of that, but I'm not as experienced as the CDC. If they say that's appropriate, I think that's reasonable. The concept is the same, where if you're coughing, you just want to prevent those virions from going past the mask. So those are the top things you could do. Really staying at home, but it's hard to do that right now. But wearing a mask is very important. So go out there. There are tons of things online where you can order masks, and like I said, Mr. Mayor, you can rewash them, reuse them. Before I move away from that subject, I really also think it's the public, we should be very responsible about using these masks, because I always like to think ahead, and thinking about today is way too easy. You're seeing what's happening right in front of us. But if we do have this, the cases increasing, or we're going to have a second wave, we should already be cognizant of what is the supply of masks we have. So we should start stockpiling these masks, not buying the whole country thing, but we have to be really cautious. And you know what, if you have a couple of extra masks at home, keep it, because we never know. We should be prepared. The first time around, we weren't prepared. We got hammered. So let's be a little bit mindful the next time, and keep a couple of masks, and be mindful of course, the production of masks we have in this country.
Thank you. By the way, for those who are asking about reusable ones, a few things. I actually bought online a UV wand, and I have a KN95, sorry, a KN95 I like to wear, and then I take the UV wand and I try to sanitize it for a minute or so. Is that a good way to also reuse a mask, especially if you've got an N95 or a KN95?
Yeah, I think I feel the N95 is not indicated at this point. People ask me all that. As a matter of fact, I brought out some masks and wanted to give it to a colleague in California. I said, no, we have N95s over here. We don't need it. And I don't think we need it. I think, if you're going into a room with someone infected, I think that's fine. Ultraviolet rays light has been proven to be very effective. It has to be done appropriately. There are various techniques of ultraviolet light, because the N95s are running out, and that's what a lot of us were doing, using this ultraviolet right there.
All right. And then Manu, who asked the question, have we seen a spike in cases in Southampton? I also posted on IGTV. The answer is no, or at least not yet. In Southampton Hospital, there are 5 COVID-19 patients and 1 patient on a ventilator. And in last week's county call, County Executive Steve Ballone said they had expected maybe to see a spike, especially given many peaceful protests throughout Long Island, and hadn't seen that spike that they maybe had expected. Dr. Piggott reiterated that. But Dr. Fernando, are we going to see a spike here in New York or Long Island or Southampton? And if so, when would you maybe estimate that's coming?
Like you pointed out, we've done great with cases here. And even, just 2 days ago at another hospital in Long Island, I mean, we used dexamethasone, which is the newest drug to treat this COVID-19, a trial out of the UK. So we're totally on top of the management over here. All doctors, nurses, all of us follow very closely the global data and on what works. And we saved a life with this new medication, dexamethasone, the steroid. So we're all ready for this. But at this point, there's no concern, but that could change in minutes, or well, not minutes, maybe a day or two, where you have this super spreader coming from Florida, coming over into the town, infecting people. And that's really all it takes. We've seen cases, of someone going to a bar, the whole bar getting infected, or a restaurant, whole restaurant getting infected. And these are realities, actually. So viruses wait for the perfect storm to take off. And we do know, as for New York, only 1% of people have been positive so far. That leaves 99% of people who have not been exposed, and it just could turn in hours or days. It could just totally change that. So like you said, I think, Manu, we've done, the mayor, healthcare workers, everyone, and all you guys out there have done a great job to keep things at bay. But these not wearing masks and people coming from highly infectious areas, Arizona, Florida, could just change that in minutes, because that's what viruses do.
So we have about 5, maybe a few more minutes, but can you just talk to us a little more about some of the treatments that are now available?
Sure.
What treatments are effective? What's coming onto the market soon?
Yeah, to be quite frank with you, Mr. Mayor, I'm pretty excited about treatments out there. I really am. Over the last 2 weeks, we've seen a lot of new treatments, which are very promising, and I really am excited about this. So let's take it back to March, where we started with this drug called chloroquine, hydroxychloroquine, azithromycin, which we started using, no data whatsoever. We were just going for it, and it wasn't successful. We quickly realized that was not successful. We took it off. U.S. trials also were working on hydroxychloroquine and azithromycin. It's really taken off the market right now. But about 2 weeks ago, we found out a drug called dexamethasone, which I'd mentioned we had treated a patient very successfully with. He required 80% of oxygen. You and I are breathing at 21%. But he needed 81% of oxygen to survive. And by using this steroid, he actually got so much better. He is now requiring only about 30% of oxygen. So you and me are breathing at 21, and now he's down to 30. So some phenomenal advances there. This drug called dexamethasone, it's really important for doctors out there, or for people who get infected, not to ask your primary doctor for this steroid. It's only been shown to be useful in people who are admitted to the hospital with a pneumonia, or if you're going to the ICU. In ICU patients, it decreases the mortality by about 35%. So it's a great drug that's out there. And a couple of new anti-inflammatories, antivirals are all coming up very nicely. This is, the whole planet has been working on research for this. So I think we've got some real good promise coming up in the next few weeks.
Good. And I hate to say this, but when will things return back to normal? I mean,
I wish
can you
I
even
had
see that?
Yeah, it's unfortunately so clear. Like every time we're trying to reopen things, and I think people like restaurants, airlines, they're all doing the right thing. They're doing it. They're very careful. But just 2 days ago or yesterday, we just got bombed by the fact that Delta had tested 550 of their employees positive. And I think everyone's working very hard. I don't think I think organizations and businesses are very careful. They're respectful to the public, and they're opening very cautiously. But when you hear things like, you have 550 Delta employees involved, I mean, when people are doing everything right, So wearing a mask, I mean, I really think there's no way out. We have to mandate a mask. It's quite simple. And, this is not a time for freedom. Like I said, think about the other person, the elderly patient, the one with a compromised immune system. Think about those. Come on, we're Americans. We all love each other. we're very loving people. People when crises like Haiti, earthquakes, we send thousands and thousands, millions of dollars. Americans are very generous at heart. And I just think it's important for all of us to understand. Once people understand, it's just not wearing the mask for you and just being uncomfortable. It's you protecting other people who are at risk. And I think the sooner people understand that, they will understand that they have to protect other people.
Got it. I'll actually answer this question because this is an easy one. Someone says, if masks are mandatory, how come gloves are not? And the answer to that one is quite easy. Even me as a layperson can answer it. The masks prevent the droplets from spreading. It prevents you from actually projecting the virus onto others. The gloves actually just cover your hand, and actually, and Dr. Fernando could complement this answer. But if you use your gloves, it's actually no different than using your hands if you're washing them. In fact, the gloves could actually make it worse if you actually touch something that has coronavirus on the surface and then keep your gloves on and then touch your face or touch something else. So the gloves actually, in my opinion, and Dr. Fernando can back this up, is that really almost a false sense of confidence. They're really not going to help you if washing your hands or the sanitizers are really good. So be careful about wearing the gloves. If you want to use it in the supermarket, great, but then immediately take them off and throw them out. But Dr. Fernando, any other updates to that question?
Absolutely, Don. You killed that answer. Absolutely. I have nothing else to add. Not guideline driven. Not remember, like you mentioned, you can actually get a false sense of security by, touching something and then putting it on your face. Remember, it spreads through the nose, through the mouth. So subconsciously touching the face. Absolutely nothing else to add.
All right, good. So maybe we'll take another question or two and then we could wrap it up. But just
Sure.
In conclusion here, we can redo our Instagram lives moving forward. But basically, we covered the spike in some states and what those effects might be. We spoke about antibody testing, being, we call it the false passport to immunity, and then we also spoke about some treatments. We briefly went over some numbers that we got from Suffolk County and Southampton Hospital. But if there's any other questions, please feel free to submit them. We can stay here for a few more minutes and then we'll wrap it up. Someone did ask, can you get COVID if you have the antibodies? I think we've kind of answered that, but would love one more answer there.
Yeah, I think, right now, the antibody tests are not reliable as well. As a matter of fact, like I mentioned, I haven't even done an antibody test because whenever you do a test, you have to ask yourself, what am I looking for in the result? And am I going to believe the results? So that's a problem. And I'm not going to believe the results, quite frankly. If we do the test, whatever comes up, I'm still going to say, well, these tests are clearly, they're clearly not up to par, and I really wouldn't believe them. So there's really nothing out there for antibodies. But stay tuned. I'm, following a lot of companies all over the country, and just to make sure that we get the best test out there. We're following very closely on this. Thank you.
Christian, by the way, where can you get a rapid test in Suffolk? Maybe Dr. Fernando will know. I do know there's actually some facilities. I actually heard CVS and Rite Aids are now doing, COVID-19 tests. But Dr. Fernando, where can you, if possible, can you get a rapid test in Suffolk? I will say I spoke to Bob Challoner, Chief Administrative Officer at the hospital. We do have a rapid testing machine from Abbott on order. They're backlogged. So ETA is about late August, early September. I hope it comes sooner. So that's when we'll get our rapid testing machine in Southampton. But anywhere else in Suffolk County, you can get a rapid test.
I honestly haven't followed that. I think that's what we're at. I agree with Mr. Challoner. I haven't been looking for these tests out there. But remember, view these test results with caution. Very important. And I'm looking at a question from a Pineapple Boy over here. People are very sensitive. Yeah, I'm glad you brought this up. So you all know the cardinal signs and symptoms by this point. You've got to have fevers, things of that. But I also want all of you to remember the rest of the world is still going on. So remember, this is tick season. So don't forget that. Sometimes it can be misinterpreted where someone with fevers, body aches, they don't feel great. And they say, well, it's got to be COVID-19. But remember, tick season is here. And, we're definitely seeing a bunch of severe cases so far, Babesia in particular. So just don't forget about other infectious diseases. Don't forget to go in for all our children, to go in for your routine vaccinations. Don't forget that, because then, we have to keep on our normalcy of life as it is. Our baseline normalcy is very important, but also obviously be vigilant for COVID-19 and really be concerned about tick-borne diseases as we go closer into the summer.
Got it. Thank you. And Jody, just to reiterate, the viral tests are reliable. What Dr. Fernando is referring to as not reliable are the antibody tests. So just to be clear, we've got the two types of tests. So I think that's it for this evening. Dr. Fernando, thank you very much for your time. We will hopefully be doing this again soon. We'll make sure we do it at least once per week, maybe a second time. As we're seeing the spike in cases, and Dr. Fernando and I are going to try to figure out a way to maybe take some Q&A on CTV. We'll reach out to them as well, and this way more people can see it who don't use social media. So to everyone who tuned in, thank you very much. It was great to see everyone. Dr. Fernando, thank you again, and we'll be in touch as well.
Thank you again. Thank you, Southampton, for watching, and stay safe. And I'm always around to answer any questions. So stay safe and keep the faith. Thank you.
Thank you. Good night.